Good day, folks. Thank you for joining us here at Your Health. On today's program, we'll be taking as many of your calls as possible. You may have tried in the past and failed to reach us, but please try again. I really would love to talk to you today. But first, let's go to our news. Let's see what's happening in the health world. Energy drinks increase the risk of hyperactivity in middle school children. Researchers from Yale University evaluated over 1,600 randomly selected school children average age of 12. They found the children that consumed the most energy drinks were at 66% increased risk of also having attention deficit hyperactivity disorder. The study also found boys were much more likely to consume energy drinks. The researchers state energy drinks may contain 20 teaspoons or more of sugar or high fructose corn syrup. The ingestion of large amounts of sweetener is also associated with obesity, diabetes, cardiovascular disease, and some cancers later in life. It would seem that the conclusion of this study is a conclusion parents have been making for many years now. When kids consume too much sugar, it affects their behavior. This same conclusion would also seem to have escaped the majority of psychiatrists as they continue to assume that dietary practices of children has no bearing on whether they will have attention deficit hyperactivity disorder, or ADHD as it's often called. How could these sugar and caffeine-laden energy drinks not affect the behavior of our children? They contain huge amounts of sugar and caffeine, and they're often promoted as a health drink because of the small amounts of added vitamins, amounts far too small to provide any real behavior benefits. Other research and the experience of thousands of parents find food allergies, food sensitivities, reactions to food additives, nutrient deficiencies, and a fast food, junk food diet, intestinal dysbiosis, and reactive hypoglycemia can all cause destructive behavior changes in children. It is the wise parent and doctor who seek to correct these aberrations before resorting to medications for ADHD. Prescription medication use continues to increase in the U.S. New research from the Center for Disease Control and Prevention finds almost every other American is now taking a daily prescription drug. The most commonly prescribed medications are being used for cholesterol control, diabetes, hypertension, depression, and cardiovascular disease. The study evaluated medication use during 2007 to 2010, the most recent data available. During this time, 48% of all Americans were taking at least one prescription medication daily. That is a 24% increase since 1995. Well, folks, essentially every other American is taking a daily prescribed medication. The report also reveals 1 of 10 Americans is taking 5 or more daily meds, while almost half of those over 45 years are taking 5 or more meds daily. We've experienced a 6-fold increase in the use of cholesterol-lowering drugs in just 12 years, along with a 400% increase in antidepressant use. Again, the most common medical conditions that are being treated with daily medications include cholesterol control, diabetes, hypertension, depression, and cardiovascular disease. Let's pause for a moment and think about these diseases and nutrient deficiencies that may be playing a role in causing these diseases. Do you have any ideas? Well, those of you who are regular viewers know that we have presented multiple studies that associate vitamin D deficiency with each and every one of the diseases most frequently treated with drugs here in America. Folks, drugs do not cure nutrient deficiencies. They will, however, mask symptoms, and that is exactly what America's doctors are doing when they fail to address their patients' nutrient needs while prescribing only medications. Do not fall prey to this type of incomplete therapy. Think holistically. Supplement your diet. Walking may provide dramatic health benefits for patients with chronic kidney disease. Researchers evaluated the health and exercise habits of over 6,000 people with chronic kidney disease. The study subjects' average age was 70. They found only 21% of the subjects exercised regularly, but those who did received remarkable health benefits. They found those who regularly walked were at 33% reduced risk of death and 21% reduced risk of needing kidney dialysis and kidney transplant overall. They also found as exercise frequency increased, so did health benefits. Those who walked from 1 to 2, 3 to 4, 5 to 6 or more times a week were at 17%, 28% or 58% reduced risk of death, respectively. The study was published in the Journal of the American Society of Nephrology. Well, folks, this is simply astounding. Exercise provides dramatic health benefits for those who have chronic kidney disease. Now, in all fairness, it's only right to help those who do not have kidney disease understand how challenging regular exercise may be to those with chronic kidney disease. Those with this disabling condition are often tired and weak, while they experience profound fatigue with even the slightest exertion. So it is asking a lot of the chronic kidney disease patients to get up and get moving. But if you can manage to walk for just 15 to 20 minutes once a week, you will receive benefits. Do more if able by working up to daily walks when your death, dialysis, and kidney transplant risk will be reduced by over 50%. We have also learned from previous research that antioxidants such as vitamin C and D, curcumin, CoQ10, and grapeseed extract, along with fish oil and the medicinal mushroom Cordyceps sinensis, all provides benefits to those with chronic kidney disease. Well, today on Your Health, we will be taking your calls, and I look forward to talking to you. We'll be right back.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online or call 888-442-1828 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Are you sleepy during the day? Many Americans are in a sleep crisis. They aren't getting a good night's sleep, so they suffer from daytime sleepiness. The reason may surprise you. You may be deficient in vitamin D. According to recent research, vitamin D deficiency leads to poor sleep quality. If you aren't sleeping well at night, you are sleepy during the day. Vitamin D and the hormone melatonin are critical to our sleep cycles. Both are tied to sunlight. This is one of the many reasons why working night shift hours can be so hard on the body. So, if you're finding yourself nodding off during the day, before you turn to another cup of coffee, try some of the sunshine vitamin and see how vitamin D can help you get a good night's sleep. For Your Health at a Glance, I'm Dr. Richard Becker. There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out our AutoShip program for additional savings. Welcome back, everyone. It is just great to be with you today, and I hope everything is wonderful in your corner of the world. Well, today we have a great show because we're going to be talking to you the entire hour. So if you've tried before and couldn't get through, please don't be disheartened. Pick up the phone and try again. Today will be the day. Call 800-635-2673. We want to talk to you today. Well, let's start by going to West Virginia and welcoming Harriet to the show. Hi there, Harriet.
Hello, hello.
Hello, how are you today, Harriet?
I am feeling great right now because I finally got to you all.
Well, good.
I am so blessed today.
Well, I hope we can help you. What's on your mind, dear?
Okay, I have several things going on. I've had a lot of dysbiosis. I have chronic urinary tract type infections.
Okay.
And a lot of inflammation I've had in my body all over, and it has been significant at times where I just thought I need to go to the emergency room. It was so bad.
Right.
But I've tried to stick mainly with the things that I've heard you all talk about.
Okay.
And I've had some people helping me out. But I also have, they diagnosed me with a non-toxic thyroid. I had the heart flutter, the, what do you call it, AFib.
AFib.
And they did the ablation.
Okay.
And so they put me on warfarin. And I'm really trying to wean off of that.
Did the ablation work? Are you out of AFib?
Well, I had two of them. I had one on the right and one on the left, and they did correct the one on the right. But on occasion, I do have some issues with the left side.
Okay. So you still have periods of time where your heart goes into the atrial fibrillation?
Well, no. I mean, it hasn't been that significant. Now, my heart will race every once in a while, and I don't necessarily have to be doing anything, but it's very rare now, but I still do have that.
Okay.
And I've had all my everything checked. In fact, I had D3 checked. It was like 48.8.
That's pretty good. Could be a little higher, but that's pretty good.
Yeah, that's what I thought from listening to you all. I thought that was good. I've been taking like 3,000.
Yeah, go to 4.
Okay.
Yeah.
And the my TSH was 1.38.
You're on thyroid hormone?
No. They wanted me to see a specialist, but I wanted to try the iodized salts and the kelp and things like that.
Well, Harriet, slow down here. Did they say your thyroid hormone was all right? It was okay?
It was non-toxic. That's what they called it.
Non-toxic, which means it wasn't elevated.
Right.
Because here's a connection that you may not be aware of. When the thyroid hormone is high, it greatly increases your risk of atrial fibrillation. It is a well-established cause of AFib. So if your thyroid hormone is good, normal, non-toxic, that's what they mean by that, and you're adding thyroid hormone to it, it could be driving your AFib. What do you think?
Well, like I said, I haven't started taking any medication for that.
Well, if your thyroid hormone is good, I don't think I would take, with your history, you could make your AFib much worse.
You were right.
Yes,
that's what I was thinking.
It'd make it so, here's the whole thing. Imagine a heart, St. Valentine's Day heart. The top is the atrium, the bottom are the ventricles, and the atrium primes the pump, primes the bottom ventricles, which pump the blood throughout the entire system. The Valentine's Day heart is a little out of proportion because in the human heart, the ventricles are 2-3 times the mass of the atrium. But anyway, the point remains. The atrium pumps, it pushes the blood down to the ventricle squeeze, and out through the periphery everything goes. And normally that beat is concerted, meaning it works in concert. The top beats the bottom beat. Lub, dub, blub, dub, blub, dub. That's how it goes. But with AFib, it's a quiver. It's like a bowl of jelly. It's not a concerted beat, and it gets out of sync. And the problem with that phenomena is, one, the pumping system is not as efficient, and two, the quivering wall of the atrium tends to collect pooling blood. It doesn't pump out effectively, and anywhere in the human body where blood pools, it's going to clot. Then that clot, after it's formed, it eventually gets ejected down in the ventricle and then up, and it can go throughout the periphery, it can go to the lungs, it can go into the brain, and what we're really concerned about is the high risk of stroke with atrial fib. And multiple studies have been done now, and I'm talking preponderance of evidence, overwhelming evidence, that we don't even have to cite the studies anymore. If you take the warfarin, the Coumadin, you're going to live longer without a stroke if you have atrial fibrillation. There's no doubt about that. But the problem is some 30,000 people every year in America have life-threatening hemorrhage from warfarin therapies. And many people have minor hemorrhages that put them to the emergency room. It's probably 100,000 or more. It's very common to have people bleed. So this leads to the question, do I really have to take this warfarin? Are there any alternatives? Well, Xarelto is a new one. They have new drugs out that you don't have to be as particular with your diet and whatnot. But the longer we use those medicines, we're finding they're really no better as far as side effects and complications than the warfarin. So there are alternatives, but it's not clearly better and easier and more successful in management, but it is an alternative that gives people options. Now, the question I always get from people is, isn't there a natural alternative to warfarin? Boy, don't I wish there were. And there probably is, but we can't prove it yet. Here's the problem. Is it ethical to compare an unproven therapy with one that's proven? Are you putting these people at risk of death? It's an unproven therapy. We know some of them who are not taking warfarin with atrial fib in this study will have a stroke. I don't want that on my conscience. That's one problem. The other problem is who's going to pay for this? The drug companies don't want anything to do with that because it may take business away from their warfarin. And vitamin companies like us, we don't have the $50 million it takes to do a 10-year study. How are we going to do that? You see, there's a huge problem here. And I know what you want to know. You want to find out if there's not a combination of fish oil and ginkgo biloba and curcumin and the platelet inhibitors like the grapeseed extract and resveratrol. Can it work just as well? I think it can, but I have no proof of that. Do you see my dilemma? Do you see your dilemma, Harriet? Are we headed in the same? You're thinking like I'm thinking, right? That's your question, isn't it?
And they want me to try the Eliquis.
Yeah, that's another option.
Okay.
That's another option.
All right, well.
Well, more people have used warfarin. The problem, and we also have a reversal agent, and they're developing reversal agents for the other. There are some things we can do, and I'd like to give you this list of things with this caveat. Anyone on warfarin, when you start a new lifestyle pattern, whether it's I'm going to have spinach salads every day, or I'm going to add a new dietary supplement, you have to do the laboratory work to see if you should reduce or increase your warfarin dose. If you're unwilling to do the laboratory work to assess your warfarin dose, don't make any changes in your life. You are playing with fire. People die from this medicine, but more people die when they don't take the medicine. That's the dilemma we have. So I think it would be helpful for you to be on a low sugar, low starch diet. Sugar causes more heart disease than fat. Trust me on that. I don't have the time to go into it. Probiotics with every meal, oil of oregano, grapeseed extract. All these things calm this inflammation you're talking about. Oil of oregano, grapeseed extract, CoQ10, L-carnitine to nourish the heart. An energy-starved heart acts out. I don't want to do it. I'm going to have an atrial flutter. I don't want to do that. Just think of it that way. The heart needs this energy. CoQ10, L-carnitine helps that. D-ribose to feed the heart, magnesium, and the last one you got to be careful with, fish oil, because it's a platelet inhibitor. It doesn't thin the blood, but it keeps the blood from being sticky, and it can complement and compound warfarin. So anytime you add any fish oil or eat a lot of fish, you have to reassess your warfarin levels. So I want to send that to you. And I certainly hope it will help you. And as soon as somebody has the courage and the money to do this comparison warfarin with the naturals, it will be big news, and you'll hear it from us. So hang in there. Your care package is coming. We'll be right back.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with GastroDefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-1828 and ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
CoQ10 and L-carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
BioInnovations brings you Dr. Becker's Bionutrients CoQ10 with L-carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net. We're back, everyone, taking your calls the entire hour today. Well, let's go to Texas now and welcome a neighbor. Hi there, Charlotte.
Hello.
Hello, Charlotte. How are you today?
Just fine.
Are you getting rained on like everybody else in Texas?
Yes.
Yeah. Well, that's the end of the drought, isn't it? It's over.
Yes, it's over.
It's over. How can we help you, Charlotte?
Okay, I was diagnosed with transverse myelitis 2 years ago.
Okay.
And then last week I went into Southwest Medical Center and they did a spinal angiogram, same thing. And
Angiogram of what body part?
Yeah, they just went through the groin into the spine.
Yeah, but where were they looking? The heart?
No.
The spine?
My spine.
Okay, I got you. All right.
Okay. Anyway, when he came out to talk to me, and my son was there, and he said that it was not, I did not have transverse myelitis.
What'd you have?
That's what, I'm paralyzed from my, well, it was from right under my bra, but now it's kind of go down to my stomach. But from my stomach down, I'm paralyzed, but I can walk.
Okay, so some of your muscle function is lost, some of your nerve function's lost, but you've retained enough that you can get around.
Yes.
Now, Charlotte, did they say that you had a spinal stroke?
That's what they told my son.
Yeah, this is a spinal stroke. Go ahead.
And then this guy said no. I said, what was it? And he said it could have been the medicine. He just said it was the medicine that you would take, and is what I think.
What in the world were you taking?
I was taking. A doctor had gave me some samples. I had a kidney, 3 weeks prior or 4 weeks before that, I guess. I had blood in my kidney, so I went to the doctor. They got me an emergency room, and they gave me some medicine. Well, my son said, it wasn't helping. So he had me go to his doctor in Rockwall. So I went there, and he sent me to a pelvic doctor because I have prolapse also.
Right. Okay. But that doesn't have anything to do with... Okay,
No.
go ahead. Continue.
No, but anyway, he wanted me to go to her. So I did, and she gave me this medicine. Let me see if I can find it. It starts with M-Y something. Anyway, I'll get it in just a second. But she gave me that 3 weeks of the 25 milligram and 1 week of 50 milligram. On the third week that I was taking it, it quit
Yes.
doing the job. And
Right.
that was on a Friday, and I said, well, there's no use in calling till
Okay.
Monday.
Okay.
So I called. I didn't get to call because I went to the emergency room. I had a pain in my right side.
Was it
and
pyridium?
in my-
Pyridium. It was pyridium, wasn't it? P-Y-R-I-D, pyridium.
M-Y, hold on just
Oh,
a minute.
anyway, it doesn't really matter at this point. What has happened probably.
Yes.
It's probably the medicine. And the doctor knew, the specialist in this type of problem knew of the association with the medicine you took. He's probably right. It
And
created
it's the only thing I was taking besides my blood pressure medicine.
Okay.
It's MYRBETRIQ.
Well, don't take any more of that.
Oh, no.
You
No.
know, Charlotte, there's a couple points here I want to make for everyone to know. Of all the medications produced in the world, America takes half of them. America accounts for less than 5% of the world's population. We have gotten into this notion that we can take any pill anybody gives us and there'll never be a complication, problem, side effect, or adverse event. And you are living proof that any pill you take, even some of the ones over the counter, can have life-threatening, limb impairment effects. Now, anybody who knows me, anyone who's practiced with me or seen me practice medicine knows I'm not anti-medicine. This is just the reality of the medicine world. And you need to be very careful in the use of any of them. Now, has the urinary tract problem cleared? Are you okay there?
I still get infections, but I'm having to, since this happened to me, I'm having to do catheterization myself.
Yes, you're going to have to. It's going to be a constant, ongoing battle. Because anytime you catheterize, you increase the risk. Can you be specific about how I can help you? I have some ideas what you might need help with, but I want to hear it from you. How can I
Okay.
help you?
I need, what it is they gave me, told me that I had inflammation in my spine, and that's why they said that it was transverse myelitis.
Well,
When they sent that, they did a spinal tap where they took the fluid off my spine and sent
Yes.
it off.
yes?
And they're the one, I think, that said I had that transverse myelitis.
But
That
this-
doctor told me that every doctor, if he can't figure out what it is, that's what he says.
Well, that's true. That's true. It's a hard
Yeah, and
diagnosis to prove, right or wrong. That's true.
Uh-huh.
Well,
But anyways, I kept telling people that I thought it might be the medicine I was taking because
Yeah,
I don't want,
yeah.
I said I don't want somebody else to end up this way.
Well, what's most important, listen, you went, Southwestern here in Dallas is one of the best medical centers in the world. We have some of the most brilliant, we have as many Nobel Prize winning researchers there as any place on the planet. And you went to one of the top specialists. I'm familiar with that department. They did what they're supposed to do, and you better trust what they told you. It was probably a reaction to that medicine, but this is the thing. People think that we know exactly the problem with everybody all the time, doctors. We don't always know. It's our best educated guess. And I tell you what, you better listen because nobody else in the world knows better than what the person you went to. So you never take any medicine like that ever again. You know that medicine and any medicine like it so that you'll never be taking it ever again. You could have another reaction, except this time you won't be able to walk or have a stroke up in the brain and then it lights out. And I don't mean to be terse with you or make fun of things, but you got to know these medicines so you don't take them. Now, we still have you have a bunch of care you're going to need. Let's just call you paraplegic. You have to be very careful with the skin. You need a good list of probiotics. I'm going to send you this stuff. Don't worry about writing it down. I'm going to send that all to you. Probiotics, all the things we use to help nerves. Alpha-lipoic acid, B12, magnesium, the B vitamins, fish oil, curcumin, the inflammation, vitamin D, and a good multiple vitamin. The one-a-day capsule should be enough with the B complex so that you have all the nutrients you need. Probiotics are critical for you. Having a healthy intestinal tract, healthy organisms will minimize the infection. Your biggest single risk is a systemic infection that arises out of the urinary tract. You can overcome that risk with probiotics on a daily basis in yogurt and that type of stuff. We have a break. We'll be back, folks. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Do you suffer from cramps, gas, bloating, or other digestive troubles? How about fatigue, depression, and headaches? All these symptoms could be caused by a condition called lactose intolerance. Your body doesn't digest lactose, the sugar found in milk and other dairy products. As a result, you can suffer from a wide variety of symptoms. If you often experience digestive problems, fatigue, depression, or headaches following meals, try avoiding dairy for a week or two and see if your symptoms lessen or go away. All of the nutrients found in dairy, including calcium, are present in sufficient amounts in other foods. So if you find that you are lactose intolerant, you can safely avoid dairy and still enjoy complete nutrition. For Your Health at a Glance, I'm Dr. Richard Becker. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-Pack. And remember, it's 50% off by the case. Give us a call at 888-442-1828 or go online at bioinnovations.net.
We're back, everyone. Let's go to Michigan now and say hello to Ken. Hi there, Ken.
Hello.
Hello, Ken. How are you?
Dr. Becker, I'm doing better than the last time I talked to you.
Yeah, your voice sure sounds familiar. I know a Ken from Michigan. Can you update us?
Yeah, I went and had a biopsy on my lymph nodes that were inside my chest.
Oh,
They
yes,
were
I
down
remember.
there, and we were thought maybe I had lymphoma like you had, and
Yeah.
it turned out to be something a lot less worrisome. They said it was sarcoidosis.
Okay. That can usually be controlled. That's good news.
Yeah, I just
I
wanted to
mean,
think
you know, if you're going to have bad news, it's one of the better bad newses to have. Usually.
Yeah.
Go ahead.
What should I take for this?
Well, what have they recommended? What have they told you? I need to know what you know about it.
Well, they actually said there was no treatment for it, and it'll just go away on its own, hopefully.
Well, there's some truth to that, but not necessarily. It's what's called a granulomatous disease. In other words, it makes granulomas. And if you were to look at a granuloma underneath a microscope, it just looks like kind of like scar tissue. Fibroblastic cells, connective tissue cells just going in every direction without a distinct feature. So it doesn't have your cancer look. It's not like that. It's not just a lymph node that's enlarged that could be infiltrated with cancer or reactive to an infection. They really don't know exactly what causes it. If it does not go away on its own, prednisone, a steroid, makes it go away 95% of the time. So that tells a person that the sarcoidosis phenomena is an inflammation reaction that's gone out of control. Because when we suppress the inflammation with steroids, it resolves. African Americans have more trouble with sarcoidosis than Caucasians, but it can happen to anybody. It can happen to anyone. So what are you doing? Are you doing anything? Did they, Ken, I want to know this. Did they mention to you two things? Did they mention to you the steroid option, and did they say anything about vitamin D?
They said if it's not affecting any organs now, it's not bothering anything, just keep going, and hopefully it resolves on itself. If it starts affecting my lungs, they could do prednisone.
Yes.
At this point, I pumped up my vitamin D to 6,000 units a day. I'm taking now. And I know it's an inflammatory condition. Is there anything else I could take besides the vitamin D?
Well, let's talk about the vitamin D. Now you're getting into things that interest doctors. It is conventional wisdom in sarcoidosis to not take vitamin D because sarcoidosis can raise calcium levels. Okay? And when we take vitamin D, you can't absorb calcium without vitamin D, so the more vitamin D and calcium you take, your blood level of calcium can increase. And so it makes sense that if sarcoidosis leads to elevated calcium levels, that you got to be careful with vitamin D. And that's conventional wisdom. And if you were to poll 100 doctors, 95 of them would say, oh yeah, you got to avoid that vitamin D. Don't ever take it. Don't take it at all. And when 95 out of 100 doctors believe something, it's pretty hard to go against them. Well, some forward-thinking researcher got to question that phenomena because the sarcoidosis actually resembles vitamin D deficiency. If you go through the process of studying what vitamin D, profound, frank vitamin D deficiency causes, it creates a syndrome very similar to sarcoidosis. So maybe that's not necessarily true. And so what this researcher found was, and this is controversial, that the high calcium level is only in the granuloma itself, not in the bloodstream. So a sarcoidosis patient can take vitamin D because the two are separate. The body and the granuloma, the sarcoid tumor, as it were, is not what the body does. So they're different. Am I making sense to you, King? Because this really is quite important. Because in Michigan, being at that higher, it's latitude, right? Up north, you're in the north. You're going to be vitamin D deficient if we don't do something about this, because I don't think you want to drink 2 gallons of milk a day. Do you? No.
I had my blood level tested, and it was 41 or something. I think it was the blood level was 41 when they discovered that.
Okay, and you've not had any trouble with hypercalcemia. The symptoms of hypercalcemia are irregular heartbeats and your muscles start cramping, and you can have seizures and lose consciousness. You've not done any of that?
No, none of that.
Well, I think it's a good idea. Here's what I think you should do. I think you should continue your vitamin D therapy, but get your calcium levels checked. Make sure that they're not elevating because, folks, your inflammatory response is controlled by vitamin D. Healing is controlled by vitamin D. How in the world are you going to get over a condition if you're low in vitamin D? You can't. What will happen is you end up going from doctor to doctor, taking drug after drug to make up for nutrient deficiencies, and that is no kind of way to live a life. It ends in despair and sickness and ultimately death. 1 million people die every year in this country from doctors doing their job the right way. not mistakes, doing it the right way. Does that not tell you we're over-dependent on medicines and surgery? It does to me. Does it tell you? Does it say that to you? It says other things, but that is included. The other thing I want to make a point, Ken, is I have had success treating sarcoidosis as though it were candida or a yeast infection. Now, don't get me wrong, it's not caused by that. But for some reason, when we correct the dysbiosis, get the candida and the other forms of yeast out of the body or get it under control, the sarcoid goes away. Much better, easier to manage. So things like oil of oregano, olive leaf. You know, people in the Mediterranean don't get sarcoid very often. Why is that? It's because that Mediterranean diet, it's so rich in these polyphenols that kill yeast. Olive leaf extract, curcumin, the carotenoids, all of the antioxidants, the yellow pigment, the red pigments, the orange pigment, astaxanthin, lutein, all these, I would emphasize these because they all help to suppress the yeast. Yogurt with every meal, probiotic daily. The oil of oregano is outstanding. So I would treat it as though it's yeast. I would take my vitamin D, but check my calcium levels. Get on a good multiple. I want to send you a good multiple, and I want to send you those anti-yeast agents. Ken, what do you think of that? Are we on board?
I think so. You know, I had my calcium checked, and it was 8. I guess
that's
8.
Fine. That's fine.
Yep. It wasn't off the chart. It's a little high, but it was. I got my.
So I wouldn't want you to do don't get your vitamin D up to 80. Don't do that because your calcium level will probably go too high. But where you have it now should be fine. I think you'll do fine. Okay.
Should I cut my calcium in treatment? I take calcium supplement every day. Should I cut
How
back
much?
on that?
How much are you taking?
It's 500
Yeah.
tablets. I think.
Do you have any dairy products whatsoever? Do you have any?
No, I don't take any dairy
A gram
products.
of calcium a day is enough for you. 2 of the 500 is plenty.
Okay,
That's
I'll
plenty.
cut back on that and
Yeah.
keep my vitamin D level up.
I would keep my vitamin D up, knowing there's a potential your calcium level can go high with vitamin D therapy. And as the research comes in, I'll try to keep everybody informed on this sarcoidosis, calcium, vitamin D issue because, you know, there are millions of people in the world with this, and they're all being handed steroids. We can do better. Let's go to our break. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings.
Here is our hope for you today. I'm Cindy Becker. In the epic movie Gone with the Wind, Scarlett O'Hara says she won't think about her problems today or she'll go crazy. She'll think about them tomorrow. How should we think about tomorrow in our lives? In Matthew 6, verse 33, we get advice about tomorrow. Seek first his kingdom and his righteousness, and all these things will be given to you as well. Therefore, do not worry about tomorrow, for tomorrow will worry about itself. It's so difficult to not worry about the future. Many of us catastrophize about the future. That's spending all your time thinking about all the catastrophes that might happen. So let tomorrow worry about itself. That way, we won't miss the wonderful things happening in our lives right now. I'm Cindy Becker. This is our hope for you today.
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
So call 888-442-1828 or go online at bioinnovations.net to place your order. Ask about the AutoShip program for additional savings.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Welcome back, everyone. Well, we have Charles from Wyoming who has sent in an email question. So, Richard, you want to take this one for Charles?
Yes. My heart really goes out to Charles. Charles writes to me that he was in a motor vehicle accident and everyone thought he was going to die. He had multiple bone fractures, 18 broken bones, broken ribs and the femur, pelvis was broken. And this has required multiple surgeries to correct all these problems. And of course, with every surgery in America today, you get a round of antibiotics, right? And now after 6 surgeries and multiple courses of antibiotics, he is so dysbiotic, his intestines are so messed up, full of yeast and abnormal bacteria. He's actually developed an infection in one of the fractures, and they call that osteomyelitis. And the standard treatment for osteomyelitis is at least 6 weeks of IV antibiotics. That's the typical standard, and it can be longer than that. Well, he is very frustrated. He's sick and miserable, and he needs help. You know, folks, this is not unusual. This happens every day. How many automobile accidents do we have in America every day? I know there's something like 35,000 deaths now every year from automobile accidents. But that twisted metal, we've all seen these wrecks. We see the carnage that it creates, and you can imagine how the bones. Well, this is tough going. Now, antibiotics disturb bowel flora. And when it's disturbed, it affects the inflammation, it affects the cholesterol control, it affects the hormonal system, the blood glucose control, and all these things in turn suppress the immune system. And it opens the door to massive infection. Because the one thing that doctors don't get in America that the worldwide research supports is when the bowel flora is altered, the altered germs from the gut travel through the bloodstream and they go to the operative site and it causes infection. The contamination isn't always direct topical from somebody who didn't wash their hands or that breaks sterile procedure. It goes through the vascular system of the patient. It's called translocation. And it's been known about for over 50 years, but it's absolutely ignored in this country. Acknowledging that phenomena, Charles, and restoring the bowel flora is the answer, because you've already had 6-8 rounds, you've had 4 weeks of IV antibiotics, and it's not getting better. Why not stay on them for the rest of your life? It's absurd. Eventually, you have to try a new way. And what is that way? Treat the dysbiosis. I want to send you probiotics. In a case like this, I want you to take a probiotic pill every time you eat food. And with every meal, I want you to have either yogurt, sour cream, kefir, cottage cheese, buttermilk. Those are the classic fermented dairy foods that you will restore your bowel flora with. The problem with the commercial fermented dairy today is that, one, it has too much sugar in it, and two, they tend to use single-strain probiotic. And so it's a good idea to do the big 5. You know, I just mentioned them. Have a little of, today is buttermilk day. And if you don't like it, I'm sorry. If you don't like buttermilk, I'm sorry. You're going to have to get used to it. This is medicine. It's medicine for your body. Hold your nose and swallow it. Or mix a little pomegranate juice in it, no extra sugar, and so it becomes a kefir. You know, you got to get over this taste issue, America. You've been eating so many sweet things for so long, you don't know good medicine when you get it. So have your probiotic with every meal. Oil of oregano with every meal. At least 2 gel caps with every meal. Olive leaf extract, 2 to 4 capsules with every meal. See, every bolus of food that would feed the yeast to grow and the abnormal bacteria, I want to have in that bolus of food stuff, the chyme that goes through, I want it full of anti-yeast measures. Curcumin, a powerful anti-yeast. It also calms inflammation. Grapeseed extract with resveratrol. Now this is going to be difficult for you, but this is life and limb stuff. So every meal you're going to have a handful of things to take. Just get used to it. It's going to work. It's going to work. I just know it is. Mushroom complex and cordyceps. Why these two agents? Because they're going to boost your immune response. Your immune system is so suppressed from all the antibiotics and dysbiosis, you're in a rut. You're in an endless cycle, and we have to boost that up. Beta-glucans are also another good choice for that. Active adult multiple vitamin and minerals, so that you have the magnesium that you need. So you have the B vitamins for healing, and a little extra B12 and zinc. One of the common causes of immune suppression in surgical patients is low zinc level. There is somebody watching today, or you know of somebody who has been hyperalimentation. This is where they feed you through your veins for months on end, and you're so depleted of zinc, your skin is a mess, you have a rash all over, and you can't get over your disease. You're zinc depleted. They don't always know what they're doing with this hyperalimentation, even today, with all that we know. And oftentimes, patients who've been in these motor vehicle accidents, their intestinal tract is so disrupted they can't eat for a month or two at a time, and they give them nutrition through the vein. And that's a good thing, but you've got to get all the nutrients in there, doctors. Zinc is essential, especially in trauma. Especially in trauma. So your B12 and your zinc, your magnesium, your vitamin D, a good multiple vitamin, cordyceps, mushrooms, grapeseed extract, curcumin, suppress the yeast, olive leaf, oil of oregano, and then replace that with probiotics. A recent review of all the worldwide literature showed probiotics work better than antibiotics in preventing surgical site infections, post-operative infections. They also work better in preventing urinary infections post-surgically. Probiotics work better than antibiotics in preventing surgical site infections. Can you believe that? It's true. The worldwide literature proves it. When will we adapt that in America? How long will it take? How many people will suffer? Well, don't wait for them, folks. You know the truth now. You can colonize your gut when you go in for a surgery. You know, the night before, eat the yogurt. Fill yourself up. It makes a difference, and it's going to help, Charles. Your care package is coming, Charles. Hang in there. We'll be back for the wrap-up.
For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-1828. Call today. I'm Cindy Becker, and this is Your Health at a Glance. Heavy metal poisoning is a growing concern, and it may play a role in your health. It can happen through occupational exposure or environmental pollution, or both. If you work in a metal shop, a smelting plant, or any type of facility that uses electroplating or welding, you may be suffering from heavy metal exposure. But those of us who live in cities may suffer from heavy metal exposure through environmental pollution. It's the #1 cause of heavy metal poisoning. It can occur over a long period of exposure, or it can happen after a single dose. Symptoms can be overlooked because they're symptoms of common diseases such as fatigue, memory loss, tremor, joint pain, and indigestion. These are common symptoms of heavy metal poisoning. If your health is declining and you haven't been able to figure out the underlying cause, discuss heavy metal poisoning with your doctor. For Your Health at a Glance, I'm Cindy Becker.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-1828 or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Richard, we've had some really great calls today. We've seen some really different issues, but yet we've seen a common thread through all of them. Let's talk about that.
You know, Cindy, when we first started this program, our calls were simple little things like I have a fungus infection in my toenail.
Right.
You know, put a little oil of oregano on it over a couple months, you're done. But today we have calls like from Charles, who's fighting for his life, and Charlotte, transverse myelitis, spinal stroke, what in the world's causing paralysis, having to go to the world's best specialist. You know, that's just so expensive to do this, and you're hoping, just hoping they have the answer for you. And Harriet with dysbiosis on warfarin, how many people are on the warfarin? They're looking for natural alternative. Researchers, if any of you are watching, and I hope occasionally you watch a program like this, please look into a natural alternative to warfarin. Prove this for us so we have options. This is so important. People need this. And then sarcoidosis. You know the theme I see underlying this? It's yet again dysbiosis. You know, sometimes it gets so dark and desperate and despair and multiple surgeries and multiple medicines, and we add a new drug to compensate for this side effect, and before you know it, it's a mess. Sometimes you have to wipe the slate clean, stop it all, and start over and go back to the basics. It's the basic Garden of Eden concept. The healthiest organic diet you can imagine, probiotics with every meal, correct the dysbiosis. Folks, if your gut's off, you're not going to heal, period. It just makes sense. Even the country doctors of 100 years ago knew you got to treat the stomach first, the intestinal tract first, then the rest can follow. Then the nourishment can do its job. But if the gut's off, it's not going to work. And you know what's most important to achieve that end is your diet, not the drugs you take. So you're always in it, you're always involved, and you're always necessary in your treatment plan for wellness. It's never just left to the doctors. Maybe that's the theme today. That's the theme today. We have to be active partners in our plan for wellness. You know it's true. You know it in your heart. Embrace it. That's where health comes from. Thank you for your kind attention. We'll see you tomorrow.
Thanks, everyone. Bye-bye.
Hi, it's me, Anthony Sullivan. And yes, you've actually caught me at home relaxing because life's been pretty worry-free since I got coverage with American Residential Warranty.
You won't believe what ARW covers. Heating and air conditioning, washers and dryers, kitchen appliances, plumbing, water heaters, electrical systems, flat screens and laptops, even pools and spas, and so much more.
Call American Residential Warranty. They'll get you covered.
1-800-935-4051. Attention timeshare owners. We're offering you a way to legally get rid of your timeshare. So call right now to qualify and receive a free consultation. You can terminate your timeshare legally and permanently. Call the number on your screen today.
Is your closet cramped and cluttered? Well, now there's Space Triangles, the clever new hanging device that fits over any hanger to save you closet space in seconds. And now may be your last chance to get them for a low price. Now you can vertically hang multiple items, guaranteeing that you'll have up to 70% more space in your closet. Your closet can go from messy to marvelous in no time with ease. The ingenious slip-over design secures the hangers vertically. It snugly fits all types of